Garry, it is so lovely to be here talking to you this morning.
Well, thank you. It's a pleasure for me to be here.
I am looking forward to a conversation all about your career and amazing life experiences and some of your lessons learned. I'm going to start by asking you to help us understand what drove you into medicine in the first place. Tell me a little bit about that part of your life.
When I was 10, Jill, I had a very favorite aunt who passed away with cancer of the breast. And as a 10-year-old, I couldn't understand why she couldn't have been saved. So I made a conscious decision to become a doctor. And the two general practitioners in my town of Winchester near Ottawa took me under their wing, literally. And when I was 12, they began taking me on house calls. I went to their offices and watched them do minor surgery. And they eventually, I even went in the operating rooms at Winchester Memorial. So that's where the start came from. I don't regret the decision for 1 second.
That's an amazing, though, seed planted at such a young age that you had those early experiences working with community practitioners. I wonder if you think back to some of that shadowing or mentorship, are there particular cases or memories that stand out?
There are so many I wouldn't know where to begin. It's strange, but at this very moment, the memory that comes back is the smell of the chloroform for some reason or other. Because they both Bill Byers and Jerry Barton, both of them gave anesthetics, and sometimes they would give a short anesthetic even in their office setting, which is quite remarkable.
Yes. I
had a chance to do that too up in northern Manitoba, and when Ken Bradley and I went to Vietnam, we would spell each other off doing anesthesia if a qualified anesthetist wasn't available. You can hardly call us qualified with 2 weeks of training.
So this seed was planted, as you say, through this loss of your aunt, early mentorship. Tell me next how you ended up going to medical school and what happened for you during training, how you ended up in surgery.
Well, briefly, I almost didn't get into medical school because I had it in my mind that because my father had gone to Queen's, that I simply had to turn up there. And one day, while the Upper Canada Village was being built, I was in construction at the time, he said, Garry, he said, I thought you were going to into medicine at Queen's. I said, yes, I am. Well, this was the end of August. And he said, well, all applications had to be in by May 31st. I said, well, that's no problem. I'll just phone up. So I phoned and got hold of Jean Royce, the registrar, and she said, that's no problem. You're in. 2 years later, she said to me, she said, why did you leave it so late? She said, the only reason you got in was that another fellow canceled that very day. But thank goodness for things that happen like that. Yeah. At any rate, no, Queen's is a wonderful place to go. And that's where I did all my, in those days you went directly into medicine in the sense that you were in the part of the faculty. So you're in pre-meds the first 2 years, so straight out of high school. And so when I graduated there, I just turned 23, which meant that I would have a long lifetime in practicing.
Absolutely.
Which was, I thought was wonderful. They're bringing that back, by the way. That brings us to junior internship, Toronto Western Hospital. And there, my very close friend, Ken Bradley, and I linked up to go up to northern Manitoba for a year of family practice. And when we came back, we got into the general surgical program together. And following that, I had 5 years total in Toronto, and then I went to Europe for 2 years for some advanced training.
Now, let's go back to the events that led to you being a physician in Vietnam. Tell me about that.
Well, I was requested to go there through the Canadian Red Cross, because in January of 1968, there was a tremendous offensive that the communists developed, which allowed for simultaneous attacking of over 130 towns, villages, cities, and hamlets. And the human loss was devastating amongst civilians. It was just carnage. As a result of that, their medical system, both the American military and the countrywide systems, were overwhelmed. So a call went out from the Americans and from the South Vietnamese to have surgeons from or as many neutral countries as possible go to Vietnam and assist. And Ken Bradley and myself, along with George Watkin from Toronto, we were the first three that were interviewed, and Brad and I went as a team. So that was kind of heady times because, as you're well aware, that the war in Vietnam was the first television war, and it was really from watching the reports that our interest was whetted. I'd seen Walter Cronkite on CBS reporting on the actions immediately following Tet, and it was just such a overwhelming humanitarian problem that as we began to think about it, and as the call came out and we were aware of it, we wanted to step right in.
Garry, could you tell me more about the actual kind of work that you did as a doctor in Vietnam?
Well, it was primarily trauma work. In those days, general surgeons did trauma. It hadn't been really established as a discipline. It did later. But my first posting from Saigon was up to Da Nang. And Da Nang was in the I Corps area, which is the five most northern provinces of South Vietnam that borders on North Vietnam at the DMZ, the Demilitarized Zone. And my requirement was to head up the Department of Neurosurgery. It was just a fortunate happening that during my training, I had 6 months at St. Michael's Hospital in Toronto under doctors Bill Horsey and Stan Schatz. And the chief resident didn't turn up, and I did. So they told me, they said, we're going to make you into a neurosurgeon in 6 months. And other than doing deep-seated brain tumors and clipping aneurysms, they were true to their word. And it turns out that years later, attending many of the American college meetings, I ran into a fair number of neurosurgeons, and when they heard my story, they, almost to a man or a woman, for that matter, they would say, well, in 6 months, you had more neurosurgical experience than we did in 6 years.
Yeah.
So I felt very confident when I arrived in Da Nang, and the cases started pouring in. Of course, there was open head wounds and shrapnel wounds to the spinal cord, peripheral nerve injuries. But what I didn't realize was that I was expected to do all the general trauma too. And my training was quite extensive. And so we were managing chest wounds, cardiac wounds, and major vessels and so on. And of course, the entire gamut of general surgery. But here and there, we had to do general surgical procedures.
Yeah.
Tumors, acute appendicitis, that type of thing.
Yeah.
Because the standard was not going away, but the trauma was overwhelming.
So Garry, I'm wondering all these years later, when you look back on that period of life, how do you see it having shaped your worldview and your identity as a clinician?
Well, Jill, I touched on this in a book that I wrote a few years ago. And if you permit, I'll just read from...
I do.
My last chapter in the book I entitled Reflections, and it really touches on this. I said, with the Vietnam War experience, we found ourselves with others in the vanguard of the development of trauma care as a surgical discipline. Canadians and Americans both wanted more cohesive management of trauma with rapid helicopter transport response, specialized triage, and dedicated trauma or level 3 hospitals. All this would come about concurrent with training programs and fellowships for trauma specialists. As well, we were just on the cusp of forming the American Trauma Society. The attributes to see all this coming together were the very virtues which should define each surgeon and surgical training program: care and caring, common sense, compassion, decisiveness, diligence, discipline, empathy, objectivity, organization, perseverance and persistence, practicality, progressiveness, skill, sensitivity, thoughtfulness, timeliness, utility, and versatility. The final word, as it should be, has been reserved for the most important people of all, the Vietnamese, including nurses, medical staff, and most important, our patients. Our combat patients had a profound and lasting effect on Brad and I, giving us ideals to follow in our own lives. Their courage and resolve in the face of extreme hardship and adversity would give us encouragement in facing life's problems and difficulties. These people had known only pain and privation during long, brutal years of warfare, lasting, in fact, most of their lifetimes. How they could be so resolute and uncomplaining when so much had been taken from them was so hard to comprehend. We could see that their lives had been turned upside down and normal life upended. I often wondered how well we would have endured their circumstances, but here was the lesson. The lesson to us was to be grateful for what one has, whether health, ability, love, family, or friends.
Beautiful.
So that encapsulates the feelings that I had about the effect that it had on me. It may have had other effects, and one question which is very commonly asked is, well, Garry or Dr. Willard, do you have PTSD? And it's not something to joke around about because it's such a serious condition. But I usually react by going something like this. However, I have to pick the person very carefully as to who I would do that with. Anyway, the long and the short is that with the book, I've decided to devote a significant part of the royalties to the treatment of PTSD in the military. As you may know, although I was sent by the Canadian Red Cross, I ended up actually being in the 1st Battalion, 3rd Division of the United States Marine Corps. And the Marines are under the aegis of the United States Navy, so my immediate superior, Captain Matthews, was the one who set us on the course of this entire adventure, really. Yeah. One day he asked Brad and I to come to his office. We were working at Da Nang Provincial Hospital at the time. And he said, look, I'm having a lot of trouble getting surgeons to go out into the smaller cities. They'd rather stay in Saigon or Da Nang or places that are more protected. Of course, being young and stupid and also realizing we were totally invincible, we said, sure, sure, just point us the direction. And what transpired was that it allowed us to get right out into the battlefields and to see firsthand what was happening. And the opportunity of working in about a dozen different hospitals in the I-Corps zone. And their last tenure there was at Dong Ha. You could literally throw a stone into North Vietnam. Yeah, we watched some of the B-52 arc light bombings that were occurring, carpet bombings, and you could just see these huge explosions. They're dropping 1,000-pound bombs from 30,000 feet, so you don't see the lines, but like a giant plodding across the landscape. Boom, boom, boom. Wow. You can imagine what was happening on the ground. Oh, God. So those memories stay with me, and I don't for a minute regret having gone there. And I always thought that what a a possibility that it was, to be of service in a humanitarian way. But in the end analysis, I have to think of the Vietnamese people themselves. They taught me more about endurance and how to be persistent.
One just fascinating little detail that you shared with me earlier is the fact that these months in Vietnam actually became credited as part of your training. It's sort of that they formed several of your months in training from the Royal College perspective.
Exactly.
Yeah.
There are a lot of people that I acknowledge in the book as thanking them for really allowing this adventure to occur. And of course, the Royal College was extremely important because I was just at the end of my training program. I was just finishing it up. In fact, the very next year, I did my fellowship and was the chief resident at St. Mike's. So the college deserves a lot of credit because they didn't ask me to do an additional time in another part of the program. They accepted that as part of the training, albeit I was training myself.
Well, it sounds like you did a pretty thorough job. Garry, I would love to know more about your medals. Can you tell me about them?
Well, for 45 years, these medals sat in a box because I didn't realize the significance of them. And as it turns out, the most important medal is the Silver Star. And it's given for meritorious conduct in a field of battle. The Bronze Star is just a little bit less than that. And am I pointing to the right direction?
Yeah.
This is the service medal. It's given to everyone who is in combat. And this was from the South Vietnamese. This is their service medal.
Any sort of memories in particular of the moments when you received those medals that really stand out for you? Or?
Brad and I were just leaving Da Nang. We'd packed up everything. That wasn't much because it was just a zippered suitcase and that was it, which we lived out of all this time. And Captain Matthew called us into his office and presented us with the bronze medal. And we were taken aback because we weren't really thinking of ourselves as Marines. We were thinking of ourselves as civilians. And they don't give them out to civilians, or at least it's very rare. And I shouldn't say never, because I did research it some years ago, and I found out that there's been about 150,000 of the Silver Stars given out since World War II. And there's just a small handful that's been given out to civilians. It's under special circumstances. So I suspect that this was on the Marine side. Anyway, I am not certain the particular incident that might have caused them to consider me for that. But I was on a mission up into the Highlands on one occasion, and we thought we were flying into a secure zone. I'd been asked to do a surgical clinic amongst the Montagnards, the mountain people, the hill people. And on the way out, we landed, it was perfectly fine, no problems at all. And on the way back to the coast, at least we were in the chopper ready to go back, and I was sitting in the seat next to the door gunner, and we were talking away just in ordinary way, and then suddenly the turbine started spooling up and it became very noisy, and then we lifted off. We went up about 300 or 400 feet, and I suddenly felt this slap on the side of my face. It just slap. And I realized that the door gunner had been shot from the ground, and this was bone and blood and brains. And immediately the co-pilot turned and pointed to me and indicated to move the body and get on the gun. Oh. It was an M60 or a 50 caliber machine gun. And Fortunately, as an Army cadet in high school with the Stormont, Dundas, and Glengarry Highlanders, I had the opportunity to go up to the Connaught Ranges near Ottawa and fire the 50 calibers. So they didn't know that, of course. How would they know that a surgeon would be able to fire a gun like that? So essentially got on the gun, fired rounds down into the jungle, and the military call it a suppression fire. In other words, if you're shooting at somebody, they're more likely to keep their heads down. And as the flight continued and we got away, it was absolute silence. You know, it really was a white knuckle occasion. And when we got to Chulai and landed, it turned out that Lady Luck had been with us too, because one of the hydraulics had been shot, and there's a chunk out of the rear rotor. So I was sitting on the tarmac waiting for transport back to Tam Key, and a Jeep came down the flight line, and just then there were a whole bunch of slicks. That's a number of Hueys loaded with infantry that were waiting to go for an insertion. So everything was really loud and dusty. And this Jeep came up, and I didn't pay any attention to it at the time, but it stopped right in front of me. And two, what I think were high-ranking Marine officers got out and saluted me. I thought, my gosh, I almost didn't salute them back. And, but they were there to thank me for saving American lives and American equipment.
Yeah. Garry, as I listen to that story, one of the things I find myself thinking about is, how does a person transition back into civilian physician life after an experience like that? What was that like for you?
What a great question. For the first bit, I had some difficulty. In fact, there were many times that we were involved with such major cases that we had no time for what you'd call minor cases. They really weren't minor. I mean, when somebody's finger is blowing off, that's significant. But we would ask our nurses to do the revision of the traumatic amputation, do the plastic reconstructive work that needed to be done. And so when I came back into practice, of course, I was really looking forward to the bigger cases, the chest and vascular and so on. But part of my practice involved a wide range of general surgery, and I'd be asked to do ingrown toenails. And it would make me angry, you know, that people were complaining about an ingrown toenail. That was one of my problems when I'd just been through this whole experience. But when I started to think about it more, and in fact, Belmont, who's known as the father of palliative medicine here, he was a classmate of mine, he really put it in perspective at a reunion one time. I said, you know, it was just a drop in the bucket, you know, what we did. He said, what you did for each individual was the most important thing. And that kind of snapped me out of that. So I was thinking, no, I shouldn't be judgmental about somebody who's complaining about, you know, a problem with their toenail. No, I'm a trained surgeon. I'll deal with it and make them happy. And that really, in the end analysis, is the most important thing, is to feel that satisfaction. Yeah.
So Garry, I'm wondering, with this incredible experience that you had as a combat surgeon, and then turning now to current times and the pandemic, I wonder what some of your observations are about the response or impact on the profession, all the healthcare professions, of the pandemic. What similarities do you see, or what automatically has popped into your head over the last few years?
Well, I have rather thought of COVID-19 as the enemy, and that this battle that was being waged globally was going to take its toll, as it would in battle. There would be people who will fall by the wayside, some from disease, and others from just the impact of dealing with it. Now, with COVID-19, initially, our nurses were heroes. And as we know, as the progression of this occurred, many got burned out, and they then referred to themselves as having gone from heroes to zeros. And I thought, how terribly unfortunate, because the backbone of our medical system is our nurses. So that part of it made me extremely sad. I was working at that time in Brampton as an assistant surgeon, and there were frequent times when the protocol was quite difficult, the masking and the gloving and the being in hazmats and so on. You could see that it's taking its toll physically on people, not just mentally. Unfortunately, I think that it created a deluge of PTSD in our medical population. And I just wish that there was a way out of this where people who have given so much of themselves get the respect that they deserve.
We talked about one major transition in your life, coming back from Vietnam and re-entering civilian medical life. But I'm wondering, you are in a later stage of your career now, and you are beginning to change some of what you do. You've had a few different roles that you've altered. I'm wondering, for other late career physicians, what kind of emotions have you navigated with that? Or what sort of insights do you have to share in terms of how a career progresses once a person is sort of in that stage of all this accumulated expertise and still very much wanting and needing to be part of of disseminating that incredible knowledge and wisdom that you have?
Well, I never thought of it in that way, but I think as we make life changes, that first of all, there has to be a rationale to make a change. And I found that as I was growing older in my career, that I wanted to get back more to my small town roots. And so although I could do all the major surgery that was sent my way at Etobicoke General Hospital in Toronto, I decided I'd like to step down and go to a small town once again. So I went to Alliston, and although I couldn't do major operations like Whipples and chest surgery and so on, I got tremendous satisfaction about having stepped back a little bit. And then it graded back even further when I had a call from an older colleague who was about to retire, who for some reason or other felt that he might make a mistake during the last 2 years of his career. And he asked if I would come and be his assistant. I thought, that's a great opportunity. So we had a grand time together because we both trained in the same era and had the same approaches to problems and so on. And while I was at his hospital, I learned that there was a great need for assistant surgeons in Brampton. So for 8 years, I went down there and enjoyed the camaraderie and the socialization, which is what people, I think, miss if they just abruptly stop their careers. So in my case, I believe that this was good for my own psyche. And my wife and I have just moved up to Aurelia, and for a year we were, our energies were going into rehabilitation of a house. It needed a lot of love and care. Anyway, having set that aside, I had the opportunity to start once again as an assistant surgeon at Soldiers Memorial. Now, talking about cutting back, I allow myself to enjoy going into surgery once a week now. And it really wasn't a formulated plan. It just kind of developed. So I think the lesson there for people going from a career to a full retirement is, look, make sure that you keep contact with your friends, keep contact with medicine. If you have that opportunity like I did, great. If you don't, make sure you have a hobby. And the most important thing, of course, is to keep your wife happy.
Makes for a happy retirement.
She sure does me. I'm the luckiest guy in the world.
Oh. So, Garry, that's great advice for folks, sort of moving into that late stage of their career. I wonder, before we end today, if you have any particular thoughts or just words to share with earlier career physicians, maybe those who are just starting out. What words, thoughts, or lessons have kept your head above water these last decades?
Well, I was asked that question actually through one of the blog sites in the American College recently. A young surgeon wondering where his career should go. Mm-hmm. And my advice to him was learn as much as you can, never stop learning, and enjoy the learning. That to me was fundamental. And then I said to him, but enjoy your life, The other aspect of it was that never miss an opportunity. I said, you're in a training program now, which has been cut back a lot because of hours. Mm-hmm. I said, in my era, you were expected to work all day and work all night and be there the next day too. I said, that was a bit much. But what is lost is that you don't have exposure to that larger number of cases. So if you can, any chance that you can, make yourself available. Yeah, make yourself available, get the experience. Because experience counts for a lot.
Garry, I wonder if you could say a few more words about your book.
Oh, I'd be pleased to do that. I may have mentioned it before, but the proceeds from the book, a significant part of the royalties is being devoted to PTSD in our military, both Canadian and American military. The book is entitled Into the Dragon's Jaws, a Canadian combat surgeon in the Vietnam War. And it's a fairly heavy-looking book. I always tell anybody who buys the print version not to read it at night, otherwise it might fall down and cause a nasal fracture. It's also, being a heavy book, it can be used as a doorstop when you're finished. Anyway, it's I think you'll find the book fairly interesting, to say the least. Many people who have read it describe it as worthy, which is a nice compliment. As I said, it's available online from Amazon and Chapters, Barnes & Noble. And the royalties that derive from the ebook are the most substantial. So I'm plugging the ebook. Mm-hmm. Unfortunately, with the ebook, as most people know, the photographs are small. With the regular print book, there are 470 photographs, maps, illustrations, most of which I took myself while I was there, and they flesh out the text. And by the way, the text is larger text, darker text, and the paragraphs are separated to make ease of reading for people who are definitely in my age group, but maybe even younger people. So anyway, this is the plug. Okay.
Well, Garry, you said the book has been called worthy by readers. And I just want to say to you, for our members listening to this conversation today, there is so much wisdom and so much we can all learn from your words. And I just want to thank you for your service, your insights, your compassion, and your wisdom. Thank you so much for having this conversation with me today.
It's been a great pleasure.
Feeling is mutual. Thank you so much.